By Flash Forward Sites. The proof is in your numbers. Learn more at flashforwardsites.com.
Welcome to Networking Arizona with host Carol Blonder. You'll hear interviews with businesses located throughout the valley. Networking, it makes a difference.
If I traded it.
Welcome to the show, everyone. I am so happy to have my first guest in, who I love having, Michael Henderson. He's the owner of Tapestry Insurance Group, in the house with me. One of my most fun. I have a couple of them, I have to say. I've been doing this for a long time now.
Man.
I have to say. But definitely one of my top. Now, first of all, tell everybody, Happy New Year to you. Welcome back to the show. Tell everybody a little bit about yourself, what you do. But today, everyone's going to say, well, why are we talking about this now? What happened? We just were talking about it. Let's talk about that.
Yeah, so, Happy New Year. There's like a time frame where it's acceptable, I guess, to say Happy New Year still.
No, I decided I get to say it all month.
Somebody told me yesterday it was January 7th is the cutoff date.
Really?
I don't know if that's true, but that's what
I've already missed it. I'm going on.
Oh, I'm still going.
Yeah.
So anyway, it's good to be back, and I hope everyone out there had a good holiday season and got some rest and relaxation or whatever with family and things. But we work in the Medicare space at Tapestry Insurance Group, and we really focus on educating the Medicare eligible population on their options, because there's so much confusion and things, and the confusion goes on. We just got done with annual enrollment. AEP was from October 15th through December 7th, and so that's what everybody think is the big rush. But for us, it never ends, because we're constantly trying to educate people. People are turning 65 all the time. People are retiring from work, whatever it might be, and so there's people moving here. So we're always trying to make sure that people have the right information to make an educated decision about their health care and health coverage as they go on to Medicare.
Well, we are live on Facebook, so I do want to say hi to everybody out there. So like us and follow us. Woohoo! We have Michael in the house. And what I would like to say to everybody now is that you can go up, and I always say it every show, because I have to do that so that everybody can, if they want to do it. Don't do it if you're driving, but if you want to, you could go onto Facebook.
Check us out.
Put in Networking Arizona, all spelled out, and you can watch us in there doing it. That's what's really cool about it. Well, right now we're live in the studio doing the show, and you can watch us. It's really fun. I wanted to talk to you because today we wanted to talk a little bit about, I love what you said. The confusion goes on.
Yeah.
There is so much confusion when it comes to Medicare. The government couldn't have made it any harder, right? But that's where you come in. And one of the things I wanted to talk about is, let's say someone's 65, right? We're going to talk about some of the things that people don't think of. We don't talk about always. Yeah. Okay? So they're still working for someone. Do they still have options with other things?
Yeah, that's a good question, and we get that call all the time. Matter of fact, talking to people even this week after the first of the year that are either, one, thinking about retiring, or two, they're going on to, or they're turning 65, so they're going to become eligible for Medicare, but they want to continue working, and their employer has group insurance. What do I do? Do I keep my employer group insurance? Do I go on to Medicare? Do I have to go on to Medicare? There's all these questions that come up, and first of all, the short answer to the question is you have options, right? That's the short answer. But you need the education to know what to do. So how much are you paying for that group insurance? How much is coming out of your check, deduction out of your paycheck? Is it more than what it would be if you dropped that and went on to Medicare? Could you save money by going on to Medicare? And oftentimes we find, unless you work for a really generous employer that pays all of it, oftentimes we find that people can save money going on to Medicare and continuing to work. You don't have to stop working if you go on to Medicare, but you can go on to Medicare, continue to work. You just drop your employer group coverage, and you save that money that's coming out of your paycheck every week or every month.
Well, that's pretty good, because I know people that means a lot to them. Every little penny counts.
It could be. Now, to be fair, Medicare Part B has a premium to it. It's $170.10 this year, but
went up a little bit.
It went up just a little, yeah. But between the costs that you're coming out of your paycheck for your group insurance, and if your deductibles calls and things like that, you may save money going down to Medicare. And that's where we have to get together and talk. I can't promise that on the radio, but we would talk with you. We would see. I just had a conversation I was telling you in the car on the way here with a woman who's turning 65 in the same kind of boat. And so we're going to get together and just talk about it and see what works.
Now, you're a free service, and we want people to understand that and what it means when they call you. First of all, what I love about Michael is he takes every single call, and you service the entire Southwest. But you like to talk to each and every one of them, because then you're going to help them if they're not in. Not when you say they're in your area, but if you can't help, and you have people in their area that work for you.
Yes, we have over 120 agents spread out throughout several states, and so my 800 number on my website rings to my cell phone. For instance, you're not going to get. It's not like a Joe Namath thing where you're getting somebody in Minnesota or wherever. It does. You're
getting Michael.
It does come to me. I have to be fair. These days, it does get a little harder to keep up with. So be patient. But if you don't have a call back in the 24 hours, give me a call back. That's never a problem. But I do want to say yes to your point. We do want to get people with an agent in their area, because it's important to me that an agent knows the area, they know the plans in your area, so the doctor networks, things like that. They're not just looking at things on a computer screen, which is the information you could find online as well. You actually are with somebody that knows your area, not just somebody that's plugging in your zip code and checking it out.
And cares about it.
And they care about their community. I was just talking about this with a person in a meeting before I came here, and it's something. We don't charge anything to our clients to meet with them and consult with them. We do get paid. We get paid from the carrier, so we are able to pay our bills. But we like to be able to, what I call, give back to the community in our time and what we do in that education. We're not just salespeople that are looking to get you to sign a form. We want to educate you, and then we go from there.
And he loves coming on the radio to talk to you all out there, to educate you.
Yep.
And I love this show for that reason, is it offers that opportunity for the people that would like to do that. And take him up on this, really, honestly. Now, when you call him, we do want you to leave a message.
Yep.
Okay. Let me explain to you. There's rules and regulations in Medicare. So if you don't leave a message, he can't call you back. And I don't know what it is with people today. I don't know. It's crazy.
Everybody's in a hurry.
Leave a message. I don't know. Take a second, leave your message, and he will call you back. Now, his phone number is 602-541-7656. So the website is tapestryinsuranceGroup.com. And he serves the entire Southwest. It will go to him. He will talk to you. He will find out if he can help you, or if he needs to, he can send you to somebody in his area.
Yep.
Go ahead.
Well, I want to throw something else out there, because I had a call yesterday from a woman who she was calling for her mother. So I just want to throw it out there, because there's a lot of times where people want to help their parents, and their parents may have questions, and they ask you as their kid or something like that, and you don't know. Call us. You don't have to be eligible for Medicare. We're here to answer your parents' questions as well.
I love that you said that, because there are a lot of people that their parents live here, or they're taking care of them, and right now things are, they don't know what to do, and so you want to help.
Yep.
The best thing to do is just give him a call, leave a message, he'll call you back, and he'll tell you how he can help. 602-541-7656. Before we go to a break, one of the things that we wanted to talk about too was people calling really quickly, and we're going to go further into it after we go to a break. But people calling the Joe Namath on television, and then all of a sudden they maybe have second thoughts, right? Oh my gosh, I'm not sure if I did the right thing. We're going to go to a break. When we come back, we're going to talk further.
We're going to go deep into that one.
Let me just tell you right now, don't even bother calling the person on television. Those 800 numbers, really, there's a real good reason why to talk to somebody local here, and that's who Michael is. He's wonderful. You can talk to him, leave a message, please. That number is 602-541-7656. It's Tapestry Insurance Group.com.
When someone close to you passes, the grief can feel overwhelming. So when it comes time to make the necessary preparations for your loved one, you can rely on Angel Cremation and Burial in Mesa. Our caring and professional staff knows you're going through a lot, so we focus on helping you understand your options. You only pay for what you truly need. To learn more about our many cremation and funeral services, call 480-962-6435. 480-962-6435. AngelsCremationandBurial.com.
Knowing every client is different, Anna von Strassenberg, CPA, PLLC, prides herself by offering ethical, accurate, and professional guidance when it comes to accounting, tax, and consulting services like tax return preparation, tax projections, proactive tax planning, IRS representation, QuickBooks, Pro Advisors, and more. For more information or to schedule a free consultation, call 480-964-4030. That's 480-964-4030. Services available year-round. ArizonaCPAs.com. Tired of paying high hourly fees when you need a plumber? With Cobra Plumbing, you get the same great service as the other guys, but you pay by the job, not the hour. So if you have a residential plumbing issue, don't wait. Call Cobra Plumbing today. Plus, our work is guaranteed. So call us today for your free estimate. Call 602-663-8432. That's 602-663-8432. To see a list of our complete service offerings, go to cobraplumbing.net.
If you own rental properties anywhere in the Valley, Denali Real Estate can provide you with the best overall value, guaranteed. Denali Real Estate Property Management offers 6% management fee, no startup fees, no long-term contracts, and a money-back guarantee. Mention KFNX and we'll fill your first vacant property for free. Please call 480-626-4062. That's 480-626-4062, or visit our website, DenaliArizona.com.
Guardian Training brings together over 30 years of military, law enforcement, and personal security experience to provide you with the best possible training to meet your needs. Prevent a future life-threatening event by learning life-saving skills with Guardian Training. Learn safe and responsible gun ownership and proper carrying for self-defense. Protect yourself today by calling 480-331-4192. That's 480-331-4192. Or view our online class schedule at readytoday.org. Ask about our mobile training system.
If I traded it all.
So welcome back, everyone. We've been talking a little bit on Facebook land to everybody out there because we are live in here. If you want to just go to Networking Arizona, all spelled out on Facebook, you can watch us in here doing it. Michael, you have been coming on my show now for, it seems like over a year or so now, a couple years,
yeah.
And it's wonderful the way that you work with your client. First of all, I want you to know about him. He is your seniors advocate. And he also is probably the most fun and, jolly, nice guy and definitely there for your clients. This is what you have said ever since I've met you. We wrote it down. This is one of the first pieces of paper that I've ever had when I work. I love saving those. Yeah. And it says it's all about education, Carol.
Yeah. Yeah.
And it is. And at the break, we were talking a little bit about, people that call, the 800 numbers. You think you're going to talk to Joe Namath or, he's going to call you back or what have you. Yeah. And it doesn't happen. And we were talking a little bit about buyer's remorse.
Sure.
Right?
Sure.
And you can have that. What do people do?
Well, so there's the good news is there's options. Again, education. Through education there's options. Education is power. And so if you called somebody or you met with somebody and you changed plans for whatever reason, it's okay. During AEP, annual enrollment was, as we said, October 15th through December 7th. That's when you can change your Advantage plan. So what happens sometimes is people will call a call center, they'll get onto another plan because they're trying to sell you something, right? And then they find out maybe their doctor's not in network. Or maybe you didn't change plans, but maybe your doctor isn't on the plan that you had anymore. Maybe he retired or sold his practice or something. You do have options. So one option is, well, you could change the doctor and go to a doctor in that plan still, but a lot of times people want to keep their doctor. So we can talk, and there's what they call special election periods out there. And a lot of people qualify for them. There's options out there for people. And that's a time frame where we could possibly change your plan either back to the one you had or to a plan that's going to work for you. Because what we're going to do is we're going to take the whole package. We're going to look at your doctor that you want. We're going to look at your needs. We're going to look at the cost of the plans, all that stuff when we educate, not just one little piece.
Well, that's what you mentioned when we were talking off break here, is that sometimes what they do on those call centers is that they're going to say, well, what are you most interested in? And then you will say whatever it is, and then they're going to zero in on that. And the next thing you know, you're on a plan and you think it's all great. But what you do is much more extensive.
We want to take the whole package, for lack of a better term. We want to look at, okay, so you want to plan with more dental coverage or whatever. That's fine. Your plan may not have another, but we're not solely going to focus on that. We want to make sure that it's the whole package. It's health insurance, so we want to make sure that your health is covered, not just your dental.
Right. So it's nice, so people get excited. I know. Because, they've been waiting for a while to get their dental covered right a little bit.
Yeah. Well, we hear from all the television ads, all these benefits that you can get, and they're all, whatever. The thing is, those ads are for clear across the country, and different plans are in different areas and things like that. So again, we want to take the full package. We want to evaluate it with all the plans that are available. Again, there's over 70 plans here available in Maricopa County, for instance, and each county has their own plans. So we're going to work to educate you. That's our goal.
And do not ask a friend. Please, don't ask your friend. Don't talk to your significant other, because everybody's different.
Yep.
You need to talk to somebody who is educated, who wants to educate, who has experience, which you do. You've been doing this for a very long time. You service the entire Southwest, and you could call him and please leave a message. It's important that you leave a message so that he can call you back. His number is 602-541-7656. It's Tapestry Insurance Group.com. As we've been talking about this, one of the other things that I wanted to talk about, which was like the first thing I mentioned when you walked in today, and I forgot all about it, was that people turn 65 every day.
Yep. When
is the right time to activate their Medicare?
That's a good question. So you can your open enrollment or your election period for Medicare is basically 90 days before the month you turn 65 is when it starts. And you can go right onto their website and you can do your application right on there. It's pretty seamless nowadays. They've actually moved into the 21st century. So you can do your application
okay, but we
right
haven't.
there. Yeah, exactly. Even if you can continue to work, you can write on the form. It'll ask you if you want to start your Social Security benefits at the same time, things like that. You can say no, and you can just activate your Medicare right from the website.
Now, let me make that clear to them, but very clear.
Yeah.
That's just activating it. It is not necessarily getting all the plan and everything.
Right.
Or is it okay,
that's a great point. So
I am so good.
You're learning. No. Well, let's go to that. Medicare is basically like an old school 80-20 plan with deductibles. And there's lots of holes in it. It doesn't cover prescription drugs outside the hospital, for instance. There's no maximum, to it, to where you're covered and things like that. So we've got plans that go along with Medicare to cover those holes in what we call holes in Medicare, or gaps. There's supplements, there's Advantage plans, there's prescription drug plans. And again, that's why we want to evaluate it. Medicare, starting that's just the basic. That just gets you the basics.
But people also need to know they don't do it for you. This is another thing.
Right,
they don't do it for you, and sometimes you're waiting for that card, and if you don't get it in the mail, you might forget. Police, I forget what I was supposed to go into the room. I went for something, I couldn't remember what it was.
Yep.
So they don't get it, and actually they could also now get fined, right?
You can get a penalty if you don't activate your Part B. But I had a woman I just talked to this week, for instance. She's Medicare age in February. She still hasn't received a card yet, so she just went on and did it. Medicare Part A, to be fair, is supposed to be automatic at 65. You should get your card within about 90 days.
Oh, really?
But your Part B, you have to apply for. But she didn't.
See, they're tricky.
But she hasn't received anything. So to your point,
right.
Sometimes you get either lost in the shuffle or the mail doesn't get to you or whatever. So you got to be proactive.
And I'm always the one that happens to.
I know, right?
It's always one
Murphy's
person.
Law. Murphy's Law.
Yeah.
No. But that's what we're here for. If you have questions about original Medicare or an Advantage plan or a supplement or your mom or dad on Medicare or whatever, we're here to answer questions for you. Hopefully we can help you get on a better plan that you're on now. But if not, at least you have the information.
Yeah.
Again, information's power.
And it's a free service. So it makes sense to speak to somebody like Michael, who is local. He is your seniors advocate. You care so much about your clients. I happen to know that for a fact, that is what you have. You've told me stories of things of what you've done and how far you go for them. And I just think that's awesome. People need to understand that it's a free service, and maybe people think, oh, it's too good to be true. Oh, it's free, so well, there must be a reason. We
get paid.
There's a hook.
I mean, we're don't get me wrong. We are able to pay our bills. We do have to support our families, all of our insurance agents out there. But there's a different mindset between somebody that's trying to sell you something and somebody that's trying to educate you on your options.
Right,
okay?
And you are with how many? You're with all of the carriers practically.
Yeah, I mean, we're with I mean, there's always one that sneaks in or something, so I can't probably technically say all, but I think we are technically, I think, with all the carriers here in Maricopa County, but there's other small carriers in California and things that we're not with and stuff. But yeah, all the, your main carriers, all your big players, and a lot of the small regional carriers we're with, definitely.
And I do love what you said earlier, too, about how, sometimes the children of the parents, you can call, and you don't have to be 65 or turning 65 to call. You can help them. They, I think that it's good, sort of like when the kids get involved too, if they can, because sometimes parents just don't know. We don't know. Even though at 65, we look a lot younger, right? The brain doesn't always work very well.
Well, and like we talked about, it's confusing. It's a lot of information.
You said
it's a lot of information.
The confusion goes on.
Yeah, it does. I think I said it in the first segment. I had a woman call me, and not for her mom, but she called me because she had questions, and when we set up the appointment to meet, I was like, do you want to be there with your mom and meet with us? And we want to empower, if you have a parent or something, we don't mind you being in the appointment, because you're going to have questions, and it's going to help the whole situation. It's going to help your parents understand it, everything. So yeah, we're here to help from a full view,
A bird's eye view.
There you go.
That phone number to call him at 602-541-7656. The website is tapestryinsurancegroup.com. He services the entire Southwest, and it's a free service to you. I think a lot of people are worried, mostly because, it's a new year. We've had a lot of things go on. Sure. People are scared with their health in general. Medication. Medication is a big thing, and making sure that they, are covered with that.
Yeah. A lot of these plans have prescription drug plans included in them. If it doesn't have one, then we need to look at your options. Again, it all goes back to everybody's situation is different, and that's where we can get on. We have quoting tools that help us. We put your prescriptions in. We can give you, what your costs are going to be. We compare plans that way. Things like that. There's a whole bunch of data.
And don't try and do it yourself. Don't think, well, I can go, because everybody thinks they can go online now and do it yourself. Yeah, but you don't know. And he's experienced. He's been doing this for so long, and he is your seniors advocate.
I'm here for you.
The phone number to call him is 602-541-7656. It's a free service. He services the entire Southwest. It's at TapestryInsuranceGroup.com. Woohoo!